This is ACEP's Capital Minute, a look at what's happening in Washington, D.C., affecting emergency physicians and your patients. I'm Laura Wooster.
The question now occurs on forwarding H.R. 5176 to the full committee. All those in favor will say aye. Aye. Those opposed, no. Ayes appear to have it. The ayes have it.
In a major legislative victory for ACEP, versions of both the ALTO legislation and emergency department-initiated MAT bills ACEP has been heavily involved in developing unanimously passed out of the Senate Health Committee this week as part of a large opioid package. After a last big push by ACEP, which included a targeted grassroots push to our 911 network advocates in states with senators on the Health Committee, Democratic Senator Michael Bennet of Colorado introduced an amendment on ALTO that was unanimously passed by voice vote, one of only a few that were even considered. This amendment added provisions of grants for hospitals to implement ALTO and $5 million of annual funding for these grants through 2023. The House Energy and Commerce Committees is working on its own version of the opioid package, and so far both the ALTO and the ED-MAT bills are signaled to be included. Stay tuned for more details.
What you reading, honey?
Medical website.
Anything wrong?
I'm pretty sure I'm having an abdominal aortic aneurysm.
Wow, well that could be serious. Let's go to the emergency room.
Not so fast.
Next week, ACEP is publicly releasing 2 new videos as part of our effort to combat Anthem's controversial emergency care policy that they've rolled out in 6 states. The insurance giant is denying coverage after the fact when it decides an emergency department patient's condition was actually non-urgent. This is a violation of the federal prudent layperson standard.
Whoa.
The videos,
Wrong,
which
sir?
feature ordinary people dealing with potential medical emergencies, show how dangerous the policy can be for people whose symptoms could be either something non-urgent or something potentially life-threatening.
See, I have Anthem insurance, and if I go to the ER with chest pain and then it just turns out to be injured ribs or something, then Anthem could deny my claim, and I'd get stuck with the entire ER bill.
That's so wrong.
The videos will be released on May 1st. For more information on the Anthem insurance issue, please go to faircoverage.org. Anthem may not be the only insurance company with this type of policy. Blue Cross Blue Shield of Texas is sending letters to some of its HMO customers telling them that, starting June 4th, they may be on the hook for an entire emergency room bill if they go to an out-of-network emergency department as a convenience for a condition they don't think is serious or life-threatening. ACEP is clearly against this policy and will be following the company's actions very carefully. Stay tuned for more updates. CMS's inpatient prospective payment system annual proposed rule was released this week and seeks comment on ways to address out-of-network billing issues, including patients being surprised by facility fees and physician fees for emergency department visits. CMS asks for input on what changes are needed to support greater transparency by hospitals around patient obligations for their out-of-pocket costs, what can be done to better inform patients of these obligations, and what role individual providers should play in this initiative. CMS is also considering making information regarding hospital non-compliance with the requirements public, and also intends to consider additional enforcement mechanisms in future rulemaking. ACEP is carefully reviewing the proposed rule to consider implications for emergency care overall, as well as EMTALA considerations around any such potential changes, and will be providing response to the CMS proposal in the coming weeks. The 2018 Leadership and Advocacy Conference is right around the corner. The conference will be held on May 20th through the 23rd. Hundreds of emergency physicians from around the country will come into Washington, D.C. to have their voices heard about the important issues facing emergency medicine and patients. Topics from preparedness for national medical disaster situations, the opioid epidemic, drug shortages, and many others will be discussed during conference sessions, as well as in meetings on Capitol Hill with legislators and their staff. This year's Solutions Forum on May 23rd will highlight innovative emergency department solutions for end-of-life issues and the opioid epidemic, and will feature as keynote speaker the U.S. Surgeon General Vice Admiral Jerome M. Adams. Other speakers on the opioid epidemic include Dr. Deborah Howery, an ACEP member and the CDC's Director of Injury Prevention and Control. For more information or to register for the conference, go to the link at the bottom of the screen. That's ACEP's Capital Minute for the last week of April 2018. I'm Laura Wooster. Thanks for joining.